ViaQuest Home Care private duty services can be provided to those who do not qualify for Medicare, as well as those who need supplemental assistance in addition to Medicare services.
My mom just came home from an assisted living facility, and we were referred to ViaQuest Home Care. Just wanted to know how you could help us out.
Great. With ViaQuest Home Care private duty services, what we do is we can do cooking, cleaning, bathing, shopping trips. We can take your mom to get her hair done, everything possible in order to help her maintain independent living in her home. What we also like to do is bring employees in to meet the families and give you the opportunity to meet with them and to interview them to make sure they're a good and comfortable fit for your mom.
Well, that sounds great because we really wanted mom to stay at home. We didn't want her to end up in a nursing home down the road. So I appreciate your time. Thanks a lot.
Thank you.
My name is Sarah Tambucci. My husband, Arthur Tambucci, and I have come to know ViaQuest in a very special way. My husband was having some issues with an open wound, and I called the doctor and said that I was very concerned. Knowing our situation, he recommended that he send a nurse out to the house. Well, the nurse was wonderful. Nancy came to the house and she was very thorough and did a comprehensive assessment. But more than that, she cared about her patient. That was very evident, and I might add, very different from any experience we had had with any other healthcare agency.
He's always a hopeful guy, very pleasant, likes to laugh, and I really like him, and I plan to stay with him for as long as they need me.
Nancy saw immediately that my husband had very special needs. He has an atypical form of Parkinson's, supranuclear palsy. There are issues connected with atypical Parkinson's, I have learned, that are critical to be attended to as part of a comprehensive approach to health care in the home. One of those is to have a team that not only individually cares about his needs, and we do have that, but a team that is cohesive and has a comprehensive view of my husband's needs.
When we come out to admit a patient, we call and make the appointment, come to the home, and we do a head-to-toe assessment plus a pretty thorough medical history. And that's very important so that we could evaluate changes in their condition as they occur. For the most part, it is the most important visit. That's how you'll also develop your plan of care from that visit as to what am I going to do for this patient, what does the family or the patient expect from me.
Unfortunately, it may be necessary for us to look for additional support in our home as this disease progresses. Fortunately, we found ViaQuest. We think this is a good match. We intend to stay with it, and we hope that our friends at ViaQuest will be supportive as they have been in the past as we move into a very uncertain future.
If you had a whole room full of people right now who just found out that they have Parkinson's, and they're going to have people coming to help them in the home like we did, what would you say to them? ViaQuest. You tell them to get ViaQuest. Why? Why would you tell them to get ViaQuest? Because you've had lots of companies come here. Why would you tell them ViaQuest?
Because they're one of the best companies.
Yeah, yeah.